Good morning, everyone, and thanks so much for joining us here on KXAN Live. I'm Will Dupree here in the KXAN Live studio. We're about to get underway with a briefing from Austin Public Health. We want to talk about their new vaccine pre-registration system that the agency is launching today that is experiencing technical difficulties because of high demand. We're also going to be talking about the pretty worrisome situation with ICU bed space here in the Austin area. We are approaching capacity. Let's take a listen now as this briefing gets underway, and we'll come back afterward to break down everything they shared and share some more information about that new vaccine pre-registration system. Let's take a listen.
Stephanie?
Good morning. We are very excited today that our portal is active and live. You can go onto our website. If you currently have been tested by Austin Public Health, please use the same credentials, use that account to sign up. And so we are excited about the vaccine. We have to emphasize it is very limited. As you all know, we only received 12,000 doses to provide our community. And as we know, we need to make sure that we provide and prioritize. The priority right now is individuals that are 65 years of age and older, including our communities of color. And so it is going to be so important that we, if we have elderly family members in our family, that we sign them up, that we put them ahead of the line so they can receive their vaccine. One of the things I'd also like to remind folks is that we cannot provide enough vaccine to the public during this time because we don't have it. So it's going to be important for you to continue to wear your mask, wash your hands, watch your social distance, only make essential trips from your home. If you're able to stay home and work at home, our preference is that you do that. We are still in a huge surge, and we need to do everything we can do to bring the numbers down. So it's important for us to stay the path and continue to do those protective health prevention methods that we have been using. At this time, I'll transition over to Dr. Escott.
Thank you, Stephanie. And as Director Hayden said, we simply cannot vaccinate ourselves out of this surge. Getting out of this surge is going to require all of us to work hard, to make sacrifices, and to stay home. To only go out if we have to, and if we must go out, to do so in a limited fashion, only to do things that we have to do, only in circumstances where we can mask and distance and follow those protective measures. While we're all frustrated about the numbers of vaccines that we have available, we have something else that works very well, and it's those protective measures. The masking, the distancing, the hand washing, it prevents disease also, and it's going to have to continue until we can get a substantial portion of our population vaccinated. So again, at a time right now when we are facing unprecedented surge, unprecedented transmission of disease in our community, which is uncontrolled, we have to work together as a community to drive down the disease spread, to flatten the curve again, to put our hospitals in a better situation, and buy us time to get more people vaccinated. With that, I'll pass it over to Janet Pichette.
Good morning, everyone. I'm just going to repeat a lot of what you've heard already because it is very important that everyone stays the course. We know vaccine is rolling out in our community and into our citizens, and I just want to make sure that everyone is reminded that they need to continue with the prevention measures. They need to make sure they're masking, social distancing, staying home if they're ill, and just making sure that you're not heading out and conducting things. Stay home if you're not doing. If there are any essential activities that you need to do, you need to make sure you do those in a limited way. If you need to go shopping, send one person from your household out. Just don't put yourself at risk, because we are seeing, as Dr. Escott and both Stephanie have mentioned, an unprecedented number of new cases that are occurring. We're still seeing the impact from the New Year's holiday and people who are traveling over the Christmas and New Year's holiday as well. So it's going to be very, very critically important for you to continue with those prevention activities.
And good morning, everybody. And I can't possibly add to what my colleagues have said here, only to say that our alternate care site is now open and it is taking patients. And that fact alone, that we are housing patients and taking care of them in the convention center, that our hospitals are overwhelmed, that should drive home how serious we are right now with this situation. The steps that you take at home are the most important things that really right now will halt this spread, just as Janet and Stephanie and Mark have said. And I will turn it back over to our pool reporters.
Thank you. At this time, we will have Molly Oak open up the questions on behalf of the media outlets. Molly?
Good morning, everyone. Thanks for always doing this. Our first question is from KView. Dr. Escott says the positivity rates in all Travis County school-age students are outpacing the community. Will his suggestion to learn from home extend into next week? And is it unsafe to be in school buildings now?
Well, again, I'm concerned about the number of positive cases, the positivity rates in our young people. As I've discussed before, one of the challenges that we have to realize is that things are different now than they were in the fall. The positivity rate is much higher, 4 times what it was in the fall. We have a new variant which is almost certainly impacting the spread of disease here. And we have increased in-person activity in our schools, with some of our superintendents reporting that some individual schools are at between 70 and 90% of occupancy. This is a recipe for disaster. It's a recipe for outbreaks in our schools. And, you know, in addition to the impact on our children's health, on our teachers and school staff's health, is the continuity of education. And, you know, we are going to quickly see that we're going to run out of teachers in order to provide in-person education. So I continue to strongly recommend that parents choose virtual education for now, and that our school districts work as much as they can with TEA in order to ensure that we can have that continuity of education throughout this semester. It's going to be a struggle for institutions right now, schools and other institutions as well, to control outbreaks that we were able to control in the past.
Okay, our next question comes from CBS Austin. When do you expect Austin-Travis County to open a COVID-19 vaccination mega site? Will it be located at the Travis County Expo Center or somewhere else?
Our plans are scalable plans. We typically have the ability to have a location in community sites where we know that folks need that access in their communities. So we have sites that are smaller community level sites. We also have larger sites that we are using now that has the ability to provide over 2,000 vaccines a day. As I stated earlier, we have looked at several options throughout our city and county, and we do have the ability to be in those locations once we know that the vaccine that we have is coming will be consistent and we can plan around that vaccine being distributed in our community.
The next question is from Estonia. What is the demand for the infusion sites in terms of doctors referring COVID patients there for treatment? Is it growing?
The demand for infusions is far outstripping the supply, not only the infusions that we are performing at our regional infusion center, but also those that are performed at our area hospitals. We are working hard right now to expand the capabilities at the infusion site out to performing 75 infusions per day. We are also working with a contractor for performing infusions at nursing homes and on patients who are vulnerable and homebound as well. But I expect, given the number of cases in our community right now, that the demand will still outstrip that supply. We are working right now on a much better referral system so that we can take more patients throughout our community who are referred by private physicians. As we opened up the infusion center last week, we've been concentrating our efforts on the underserved, people of color, and folks from areas that are hardest hit by this pandemic.
The next question is from patch.com. We continue to see disproportionate rates of illness among minorities. Will these segments of the population be given priority in receiving vaccines or be subject to other therapies to mitigate illness?
So our site selection process for the vaccine distribution facilities was intentional. It was designed to be located in those areas that have been hardest hit in our communities of color. We wanted to have ease of access for those communities who have been just incredibly disproportionately impacted here locally. Similarly, as Dr. Pickett mentioned, we have prioritized those communities for those infusions of monoclonal antibodies. We've located that site in an area that has been hard hit to make it easier for folks to get that free treatment. So we are trying to work very hard to provide access, ease of access to those communities in addition to making vaccine available to those groups.
Next question is from Univision. Can you confirm if there have been any cases here in Travis County of the new variant of COVID-19? We were informed there might possibly be a child in Del Seaton who tested positive with it. Is this true?
To my knowledge, that has not been confirmed or reported to us as far as having a new variant. We are aware of a variant, the UK variant that was detected in the Houston area in a person who had no travel history at all, which tells me that it is likely circulating in our within our state and could very well be in Travis County. However, there have been no speciation studies for that specific variant for us to determine if we have that same variant circulating here in our community.
I'll just mention also that it's implausible to think that it's not here in Travis County. If it's in Texas, as we've learned from the initial phases of COVID-19, if we're seeing it in the state, it's here also. It's very likely, almost certainly contributing to the spread that we're seeing. And once again, we have to understand the difference with this variant. It is easier to catch from the data that we have now. It is likely contributing to the surge that we're seeing. And what that means for all of us is that we have to take extra precaution. We have to ensure that our encounters are only masked encounters where both people are wearing masks, where there's social distance. We should stay home. All those things will still work for the new variant, but we've got to be more careful now.
Community Impact asks, we've heard reports of some people receiving the vaccine who didn't pre-register or qualify for phases 1A and 1B, but simply showed up at a vaccination center. What happens to these people in terms of getting a second dose? Will a second dose be set aside for them in the future?
Ultimately, the goal is for us to provide the vaccine to our community. And so we typically, the plan is for us is to provide vaccine to people in the 1A and 1B category. However, if others have received the vaccine, each of us as providers, we are required to provide that second dose to them. We will not provide an initial dose and neglect those people and not provide that dose to them. And so, yes, they will be provided their second dose. And so it's important that we just cannot emphasize that we want us to prioritize. I understand that everyone is very eager to get the vaccine. We're very excited that it is here in our community, but we must prioritize our elderly family members to ensure that we are taking care of them first. Please make them your priority.
And let me just add on to that by saying that the federal government, the state government, the city and county government, our surrounding communities are working very, very hard to get vaccine out. We have to remember that we are about a year past when this virus was first identified, and we're already talking about vaccinating millions and millions of people across the United States and across Texas. We have to understand the reality. The reality is that vaccine still has to be made. It still has to be shipped. It still has to be stored and given. And those things take time. We are working locally at the state and federal level to ramp up our ability to vaccinate people quickly when that supply is here. Until that stage, we have to continue to remember that we can protect ourselves, we can protect our families, we can protect our community by following the simple steps that we've been talking about for a year. Washing our hands, staying home, distancing, and masking. Those things work, and we have to continue to do those until we can offer vaccine to everybody.
Co-op asks, the Houston Chronicle described Texas's vaccine rollout as a, quote, game of luck and chance, end quote. Will more vaccine doses and mass inoculation sites relieve or exacerbate this dim view of the process so far?
Again, people are working as hard as they can to get this vaccine out to the right people. I think often what people call to mind is, a handful of people who fell outside the 1A or 1B group got vaccinated. The absolute priority for every vaccine provider is do not waste vaccine. Because this vaccine requires ultra-cold storage and it has to be thawed, and there's a short lifespan of that vaccine once it's thawed, we are going to continue to see circumstances where people outside that 1A and 1B group get vaccinated in small numbers because they have to get it out. Sometimes that's within a few hours, sometimes it's a little bit longer, but the vaccine has to be used. Vaccine is not wasted if it is in the arm of a Texan, and that really needs to be our focus and priority. I think that it's likely that we'll see substantial increases in vaccine availability, particularly when the AstraZeneca product is approved for EUA. And I think we'll see the market flooded very quickly. But until then, I think we have to, have some forgiveness for groups that are really trying to do the right thing, and that is get vaccine to Texans.
This next one is from KUT. What proof of underlying conditions will Austin Public Health require for its vaccine sites?
We cannot examine or ask patients for that information. So it is that's a conversation for a person to have with their physician, and it is that is not the type of information that we collect at the vaccine site. We can't check a blood sugar on somebody to prove that they have diabetes. So that is in reviewing the categories. It is for that individual to make that determination with their physician if they fall into that 1B category.
And I'll just add that, we know the vaccine's here. We know that there is an overwhelming need for it and want and desire to get vaccinated in our community. We just really need to make sure that people are aware, like, until your time is presented to you to get vaccinated, that you need to be mindful of those people who are at highest risk and try to allow them to go first. We're asking people to follow the rules and follow the strategies. And, we're just hoping that everybody is patient and in the interim time period before they receive their vaccine, that they continue to use, preventive measures to control the spread of this illness.
This question is from Austin American Statesman. Does Dr. Mark Escott believe the 25 staffed beds at the Austin Convention Center will be enough to treat COVID-19 patients in the coming weeks, or will more staffed beds likely need to be added?
More staffed beds will be added. We actually have staffed beds there. We have 250 of them, and we have the ability to expand that out to about 1,000. When looking at our projections recently here, we anticipated an initial rollout of 100 beds, and this resource is scalable. So we've opened those 25 beds. We can very quickly open the next 25 and the next 25, the next 25, and so forth as needed. But it is our expectation, based on what we saw in El Paso and the number of beds that were required at their alternate care site, that we would need to start around 100 and then see where we go from there.
The Daily Texan asks, what work has the city done with UT Austin to minimize the risks of potentially tens of thousands of students arriving in the next week for the start of the semester while the pandemic is reaching the worst it has been in Austin?
The University of Texas have been great partners with the city of Austin and Travis County since the beginning of the pandemic. They implemented proactive testing thousands of students, faculty, and staff each week. They plan to continue those efforts. I think their messaging has been strong that the virtual option is an option that folks should choose to help limit the on-campus population. And I feel strongly that they will continue to be our partners in this as we move forward in our vaccination efforts. So again, we're providing UT the same advice as our schools, and that is, if you can go virtual, go virtual. If you can't, minimize the numbers of people who are in person in buildings to reduce the risk of spread. Ultimately, though, for all of our young people and really all of our community, it's not just about how you conduct yourselves in that school or college or work setting. It's about how you conduct yourselves outside as well. And we are at a stage right now where if you can't do something with a mask on and distanced, you should not be doing it. And that means social gatherings, that means meals with people outside your household. We really do need to reduce the risk substantially right now in order to flatten the curve so that we can put our hospitals in a better situation and help our vaccine efforts as well.
And I'll just add that UT Austin has, like Dr. Escott mentioned, been a great partner with us. Not only have they been, taking care of those faculty and staff that are on campus and students, they've been working with us very closely since the beginning of this pandemic on case investigation and contact tracing of those individuals who are positive or exposed within the 40 acres. We've been working with them very closely. We have weekly meetings with them just to make sure that if they have any issues or if there are any clusters of cases identified, that we can assist them with any kind of intervention or follow-up. So again, they have been a strong partner for us, and we appreciate them being in our community.
One thing I would also like to add is we have been working very closely with UT Dale Medical School as well. They have really been an extension of the city of Austin. And so it is important for us to establish those collaborations, not with, just the University of Texas, but there are other partners across the city that are working with, whether it's at the school district level or higher ed. But the partnership has really contributed to us as a community being in a really good place overall with our partnerships and able to get things done in our community.
This next one is from Box 7. Circling back on your answer to the large vaccination sites, other cities like San Antonio have designated large vaccine sites such as the Alamo Dome. Is there any reason APH is not doing this and releasing site info to the public?
The site information will be released on tomorrow because individuals our portal is live today. We've had over 20,000 individuals that have signed up with accounts. And so, as you can see, 20,000 individual accounts. And as you know, we only received 12,000 doses of vaccine. And so what is going to be essential for us, we know that our plans are scalable. We have viewed several sites, and we are ready to establish smaller scale as well as large scale events. Even have the ability to do drive-through locations, etc. So we have multiple plans in place. We are definitely ready to activate, but we must have an idea of what kind of vaccine we are going to provide in our community to mobilize and establish those sites.
This one comes from KXAN. On social media, there are a significant number of posts about people just showing up and getting vaccinated at a specific one of your sites. People said, despite saying the opposite, you did not need an appointment. Are you aware of this? What happened? Do you feel people got vaccinated yesterday who were not in phase 1A or 1B?
We are aware that those pods are closed pods. Those pods were established for the majority of 1A and some 1B folks. And so with individuals sending the word out using social media, we are aware that that has occurred. And this is a message to anyone that is going to show up there today and anticipate that they will receive a vaccine. We cannot provide you a vaccine if you do not have an appointment. We can provide you information about how to go onto our site and to schedule you a vaccine. But moving forward, we will not be able to provide vaccines to individuals that show up at those sites and don't have an appointment. Ultimately, our goal is we're not going to waste vaccine. We had people that were in the line that had stayed in the line. And so out of a common courtesy, we decided to go ahead and provide that vaccine to them out of being courteous to them. In the future, we have to just emphasize that is not going to be the case moving forward.
This question is from KView. Can you address the issues with the vaccine registration site that people faced this morning? Additionally, what are vaccine providers doing with vaccines that are left over in vials at the end of the day?
We can speak to what has happened at our vaccine clinics that we've set up, our closed pods. We have used all of our vaccine. We have not had any waste in the vaccines. On the first day of our pod, we served 850 people. Yesterday, we served 1,640 people. And so prior to that, we received the 1,300, and we've provided those vaccines as well. Through our wellness public safety location, they have provided those as well. And so the goal is that you really don't want to waste any vaccine. And the goal is you want to be able to provide that vaccines, you want to get it, you want to provide the vaccine to people, and you don't want to waste any of it.
I'll add that talking to other vaccine providers in the community, they are taking a similar approach, and they know, as we all do, how precious this vaccine is, and we're making sure that not a single dose is going to go to waste. So they're as consistent with the guidance from the state, they are putting vaccine into people's arms as quickly as possible, and 1A and 1B, and making sure that every single shot gets used and nothing goes to waste.
And I'd just like to add that, we recognize that there's an overwhelming demand for vaccine right now. And I think that's been demonstrated by people going to our registration site and having challenges logging in and those types of things. We'll continue to work with our IT partners to make sure that that's operational and up and running. And I think there, again, like we've said, just we're one provider of many in the community, and we're all working our very hardest to get vaccine to the point where it's available to the community. But we continue to ask for patience for those folks, or for our providers who may have clogged phone lines and access issues to the computer to get registered. So again, we continued patience is what we're asking for.
CBS Austin asks, how many patients are currently at the alternate care site? How would you describe their condition?
At the moment, there are no patients at the alternate care site, although we are expecting several transfers today from the hospitals. Regarding condition, the alternate care site is for patients of low to moderate acuity, meaning they need some additional oxygen assistance and assistance with medications, but they are not critically ill. If a patient is critically ill, then they will be at a hospital.
I just want to add that we will be working to display those alternate care site numbers on a daily basis through our regular updates each evening. So we'll have a specific number to report each day for the ACS.
Austonia asks, in terms of current case investigations, what role are 20 to 29-year-olds playing in spreading the virus? Are cases being traced to bars, social gatherings in this group?
I'll start generally. Again, post Christmas and New Year's, 40 to 50% of the new cases each week are in that 20 to 29 and 30 to 39 age group. As we've seen following previous holidays, we're starting to see some spread out to older age groups as well this week and last week. So again, our concern is that young people may not have as severe of a course. They may not end up in the hospital as often as older people, but they can spread disease efficiently. And that's why every age group needs to take protective actions to protect the entire community.
And I will add, from the case investigation perspective, we are definitely seeing surge related to, the holiday gatherings and New Year's Eve. We are specifically seeing an increase in travel-associated exposures and illness. So people who actually went out of town to celebrate the holidays with family members and loved ones, and who are returning, and now they have disease or have, exposed somebody else who they've been in contact since their return from those their vacation. So, if you travel out of town, especially if you travel by air, you need to make sure you're using your prevention measures, making sure that you're wearing your face coverings to protect you from exposures to others on the plane. And when you return, you should consider a 7-day self-quarantine period with a follow-up test, if possible, before you go about returning to work and other activities.
I also want to add that, again, we have testing free through Austin Public Health. So it's very easy, and it's no cost for folks to get that proactive testing, even if they don't have symptoms, before they turn to work after they've returned from a trip. I also want to remind our community that we have isolation facilities. That is a hotel that is free food, free Wi-Fi, free TV, as a place that people can go if they have symptoms, if they've been exposed and want to protect them, the rest of their household, that they can go there and do that to prevent that household transmission. A lot of what we're seeing after the holidays is household transmission. And one way for us to try to mitigate that risk is for folks who've been infected to move to a separate facility if they can't isolate effectively in their own home to prevent spreading to one another.
Patch.com asks, please expound on why the Pflugerville testing site was changed to appointment only. Demand was cited as an example, so my question is, how many residents have used this site and or use on a given day, and what is the racial and ethnic makeup?
We changed that location to appointment only location because that made it align with what the other sites were doing. That typically works better for an individual to know what time they need to be at that location. And it's an easy process for them to be in and out of the facility. In addition to that, we have to have an awareness about the traffic control, because if you don't schedule appointments, that creates more traffic. And so it was a safety hazard for people to crowd around that facility, be lined up for several hours waiting on a test, and then the safety from the parking. At this time, I do not have the demographic information for that location. That site definitely was a very busy site for us. And that was one of the reasons why we have wanted to make the changes to make it to be more efficient with appointments.
This question is from Univision. Is proof of residency in our county required to be able to get the vaccine? How will we prevent people from other counties from getting vaccinated?
According to the Texas Department of State Health Services, anyone can receive a vaccine at any location in the city or county in the state of Texas. We do caution folks that it would probably be easier for you to go to a testing site in your community. Definitely with the limited access, we feel like it is important for you to take advantage of that in your community. However, there is no residency that you need to prove which city or county that you live in.
This question is from Co-op. From the VaxFacts document circulated by APH, what does it mean that, quote, the ability to respond to the current surge in COVID-19 will determine our ability to distribute vaccine?
So I'm happy to answer that one. We have to all remember that the entities, the people who are providing vaccine are healthcare workers. The people who are doing testing is healthcare workers. The people who are caring for this overwhelming surge of patients in our hospitals, in our clinics, in our urgent cares, in our emergency rooms, in the alternate care site are healthcare workers. So we have a massive focus right now on caring for people, ramping up the capabilities of the hospital, ramping up the capabilities of testing. And it's going to be more challenging for us, not only in the city and county, but across the state and across the country, if we are focused on an unprecedented surge in our country, to be able to ramp up appropriate resources for vaccines should a much larger number of vaccines become available. I think one of the best solutions that we can identify is that if we can reduce transmission, if we can reduce the impact on the healthcare system and our healthcare workforce, it's going to allow more resources to be moved over to the vaccine effort to allow us to scale up very quickly.
KUT asks, for people who have pre-registered but don't qualify for a vaccine just yet, will they be contacted by APH when vaccines become available for them?
Yes, our goal is to get as many people registered on our site, and when we have more vaccines available, they will be contacted based upon when they contacted us. Our hope is that there are other providers, and they are looking at the DISH's website to see where that vaccine is available as well. So they would be looking at what Austin Public Health has available, but then looking at the DISH's website to see if there is any provider that they can go to in the meantime.
This one's from Austin American Statesman. Does Austin Public Health foresee other vaccine providers in Austin Travis County joining the vaccine pre-registration system? Has anyone shown interest or started the process of joining?
We have had conversations with other counties. We've had conversation with Williamson, Hayes, and Bastrop County. With our Salesforce platform, Williamson County and Bastrop are current partners with us for our testing efforts. And so we're going to continue those conversations, but that is something that we are open to with our other partners in the region.
And I'll add to that by saying that we have other very large partners who are capable of doing high volume vaccinations, such as the HEB system, who's indicated to us that they may be able to do 4,000 vaccines a day through their existing infrastructure. So what we're likely to see is that multiple large hubs are going to emerge over the coming weeks as the vaccine supply becomes more plentiful. But we are hopeful that we can get some of those hubs, particularly with our county our neighboring counties in partnership like we've done with testing, to ensure that as a community we have at least a central location for folks to identify access to those public hubs. Again, we have full confidence that today, through our partners, we can distribute 10,000 vaccines a day. We need the vaccines. We need the assurance for the flow of vaccines and supplies for the weeks to come. Once we get that, we can ramp up very quickly.
The Daily Texan asks, what are the risks of the B.1.17 variant in terms of acceleration of the disease's spread while vaccination is lagging?
Well, we're concerned that the variant is more contagious. It's going to make it more easy to spread. It's going to make it more difficult to control, particularly in those institutional settings, schools, jails, universities, other places where people congregate, restaurants, bars, stores. And that is why we are strongly encouraging folks to stay home, to wear the mask, to distance, to not gather with people outside their household. We have to act in a more protective way. Part of the challenge that we have is that, people think about the past 10 months and they say, well, I've been doing this or that and I haven't gotten it for 10 months, so I can do the same things and it's still going to protect me. That's not true. That's not true because of the new variant, which is almost certainly here. That's not true because the positivity is so high right now. There are simply more people infected out there in the community. So that means we have to modify our behaviors. We have to act in a more protective way than we did in the fall in order to flatten this curve so that we can buy more time to get more people vaccinated and really save lives.
Fox 7 asks, with herd immunity as the top goal, is there any concern about people refusing the vaccine and not enough of the population being inoculated?
We do have substantial concern about that. We have seen a lot of misinformation online, and that has been influencing behavior and making people hesitant to take the vaccine. What we know is that despite all of the efforts that you've seen in many places with lockdowns and distancing and masking, that has not yet been enough to stop the spread completely. And the vaccination is the most important thing that will be I think the nail in the coffin of this virus is getting people vaccinated. Recent history shows us how important that is. Smallpox, which devastated the human race for centuries and killed 300 million people in the 20th century alone, we never achieved herd immunity to that disease until there was widespread vaccinations. So that emphasizes the importance of this vaccination in stopping this disease, and there is a flood of misinformation that we need to counter. And I encourage people to go to reliable sources of information on the vaccine. Come to our Austin Public Health website, go to the CDC and the WHO, and places that can give you good information that's free of a lot of the conspiracy theories and other misinformation that's out there.
And the last question comes from KXAN. Do you still expect Austin hospitals to run out of ICU space tomorrow? What happens then?
So I can take that question. So the projections still anticipate that will be the case tomorrow. Again, our hope is that we're wrong on that. Our hope is that we've changed behavior enough to avoid that, but I don't think that's going to happen. So that's the median projection. It could vary. I announced yesterday that we were at 190 admissions, only leaving 10 left. So there's not a lot of room left in terms of exceeding that 200 mark. So what happens? Well, the 200 number that we've been talking about for months is the maximum that anticipated that we can utilize for COVID without impacting substantially the rest of the people that need to be in the hospital. There are certainly more than 200 ICU beds in our MSA. The problem is those are full. Those are full with people with heart attacks and strokes and car accidents, people who've fallen, people who have cancer, who have lung disease or other conditions. COVID is not the only thing going on in our community, and our hospitals simply don't normally operate at a capacity where there's lots of extra space. So that's why we're trying to keep the numbers down so that we don't impact the ability of those other patients to be able to receive care in a timely fashion. We are already seeing an impact because we've had to cancel elective surgeries. That means people are going to have to wait longer for things that they need done. As the situation grows, as the hospitals become more overcrowded and the ICU space dwindles to zero, that's when we talk about things like the crisis standards of care, having to triage who gets that treatment and who doesn't. We do not want to face that situation here. We do not want to have to decide as a medical community where to draw the line on who is survivable and who is not. But we all have to work together because that is a potential future if this surge continues in a manner that continues to overwhelm our hospitals.
Thank you, Dr. Scott. Now we will start with our closing remarks. Stephanie?
Just a reminder that I know that everyone is excited about the vaccine, and we are very excited about it as well. We know that we only have 12,000 doses of vaccine. We are aware that over 20,000 individuals have signed up to be users of our system. We ask that you be patient with us. As we have information about receiving more vaccine on a constant basis that we can plan our efforts around, our community will see more locations that will be able to provide the vaccine to our community. In the meantime, even if you've received a vaccine, it's important for you to stay at home, only go out for essential trips only. Especially wanting you to continue to wear that mask, watch your distance, wash your hands, and especially if you're feeling ill, please contact your medical provider. We are continuing to provide testing for our community. It is free, and so we would love for you to take advantage of that. But please just make sure you're doing everything to keep you and your family safe. With that, I'll transition over to Dr. Scott.
Thank you, Stephanie. Again, we cannot vaccinate ourselves out of this surge. That's going to take us sacrificing, making decisions to protect ourselves, protect our family, and to protect our community. We are grateful for the partnership with our local healthcare providers, our community partners, the state of Texas, the Texas Division of Emergency Management, the Texas Department of State Health Services. Both are supporting the efforts here at vaccination, at testing, and alternate care site and our regional infusion center. We have to all work together. We have to stop the fighting and the debating about simple things like masking and distancing. We all need to understand that we are in this together, and we can only be successful together. With that, I'll pass it over to Janet Pichette.
Thank you. And I just would like to say we are very optimistic and grateful that we do have vaccine rolling out into our community and into some of our patients or community members. But we need to still control the surge within our community because while there's a huge demand for the vaccine and we're responding to that, we are still also responding to huge number of cases that are becoming positive in the community. And so, as you've heard both from Stephanie and Dr. Escott, we need to make sure that we're doing all those prevention activities to make sure that we're tamping down the outbreak itself and reducing transmission risks within our communities. Again, as we said over and over, cover your face with a mask, social distance, avoid touching your face with your hands, wash your hands frequently, and if you're sick, please stay home because you could have COVID-19, and if you do have symptomology, please get tested. This with vaccine will help reduce transmission.
And I'll close it out by saying I understand that there are a lot of people with questions about the vaccine who have concerns about the vaccine side effects or long-term effects. Those are understandable. We all want to make an informed decision about what we put in our bodies, and this is no different. What I can say, though, is that the negative effects of the virus itself are far worse than anything that we have seen as far as negative effects of the vaccine. Your chances of a good outcome are much, much, much better by taking the vaccine. And this is such an important step to ending this pandemic.
Thank you. That concludes our media availability for today. Thanks to APH Director Stephanie Hayden, Dr. Mark Escott, Chief Epidemiologist Janet Pichette, and Dr. Jason Pickett. Also to our poll reporter, Molly Oak from KView. Thanks for joining us and have a safe day.
Will Dupree, once again here in the KXAN Live studio. Thank you for sticking around for this full stream from these remarks from Austin Public Health. A few things to hit before we end our stream, and we do, again, appreciate you all sticking with us here for this. First up, Austin Public Health announced this morning that they had launched this pre-registration system so that people in the community could sign up to receive a vaccine through Austin Public Health itself, since it has been identified as a mass vaccination hub by the state, meaning that it has the potential to vaccinate as many as 100,000 people over a period of time. We do know now, though, that there is technical difficulties reported with this particular system, and I want to show you all really quickly and pull up the lead story on our website right now is high demand leads to technical difficulties for Austin COVID-19 vaccine pre-registration system. And we'll also show you this particular tweet from Austin Public Health urging people the COVID-19 vaccination pre-registration scheduling feature has gone offline. We are working to restore it with the vendor. Please stand by while our team resolves the problem. And then finally, if you go to that particular site, so it's austintexas.gov/COVID-19-vaccines. I'm going to just refresh this really quickly. There is a message right here at the top, and I'm going to highlight it. Due to high demand, our vaccine pre-registration system is experiencing technical issues we are working with our vendor to resolve. So please know that if you go to this particular website, we do have the link to it on our website, kxan.com. If you go to sign up, please be aware there may be issues that you run into because the Austin Public Health experts that we just heard from say that at least 20,000 people have now signed up to get a shot for COVID-19 through their system, and that has simply overloaded it at this time, but they are asking people to be patient for that, so we just wanted to point that out too. Additionally, so we wanted to mention that pre-registration system now that Austin Public Health has launched at this time. We also learned this week that the alternate care site that's been set up at the Austin Convention Center in downtown Austin has now been opened, and they are going to expect patients to start arriving today. These are people not with COVID-19 that have a low amount of care. They will be sent to this facility. So we'll have to wait and see how many people actually show up and are admitted to that alternate care site today. That number may be released at some point later today. We'll report on that as soon as we get it as well. Additionally, if you might have missed, there were comments and questions asked about schools returning and how safe that is exactly. And Dr. Mark Escott, the interim health authority for Austin Travis County, said directly that families should choose to keep their children at home if possible to do remote learning. And this is because of the spread of COVID-19, the strain that our intensive care units are feeling at this very moment. And he is saying, he warned that if in-person learning and occupancy at particular schools is too high, that we could very well run out of teachers because they themselves are getting sick. So, Dr. Escott, again, that top doctor for our city and county, is asking people to keep their kids at home and learn remotely if at all possible. Additionally, a lot of concern has been raised after this new variant from the United Kingdom has shown up here in the United States, including in Harris County. A man there last week tested positive for COVID-19, and it turned out that it was this new strain of the coronavirus. That strain, according to experts, is more contagious, so it's more easily spread among people, but it may not be any more lethal than the original strain that we've seen and has sickened a lot of people. Dr. Escott and the other health experts are saying that it's very likely that that is in our community at this time and is contributing to the spread, the amount of infection we're seeing, and the surge that is being reported at this time. If you would like any more information about this, I know that's a lot to cover in just a very short amount of time, and that was a lengthy briefing from Austin Public Health itself. We're going to try to break this all down, synthesize it, and put it up on our website. Again, that is kxan.com, and the KXAN News app is available on your smartphone, so please download that if you've not done so already. Okay, thank you all for sticking around for us as long as you have. I'm Will Dupree here in the KXAN Live studio. As those experts said, we need to keep doing what we've been doing, and really they nailed it down succinctly. We need to stay at home as much as possible, only go out for those essential trips, which I know is very difficult to be able to say. Wear your mask, social distance, wash your hands, don't touch your face if it's all possible. These things really do help control the spread of COVID-19. It's been proven over and over again and shared by the experts. So please, let's just do it. All right, everybody, we'll see you another time. Take care.